Well, let's look at the public health facilities in Nigeria's healthcare system. And to join me to discuss further is the former chairman of Nigerian Electricity Regulatory Commission, Sam Amadi, to discuss our nation's healthcare as well as preparedness to tackle the COVID-19 pandemic. Good to have you here on the News at 10. So, yes, a few days ago, Secretary to the Government of the Federation, Boss Mustafa, recently acknowledged the deplorable condition of our healthcare system since he became the chairman of the Presidential Task Force for COVID-19. So how would you assess the public health response in containing the spread of the virus and our level of preparedness?
Well, hello, hearing me?
I can hear you. Go ahead.
Okay. Yeah, thank you very much. I think first, I think so far, well, we've done some things right, but the basic failure, in my view, is a lack of governance process. Today, we're talking in terms of lockdown, and the critical driver of lockdown is that citizens, especially those who are work at their work, those who work every day, can find some degree of palliative, and government has rolled out palliative. But the problem is, we don't have data sets. We don't know who is for. We don't know how to locate our people. So basically, the governance deficit in terms of getting the numbers, what is the criteria, who is where, is what is going to cause us problem. Yes, we can ask people to stay at home and they're staying at home, but the problem now is that with extension, possible extension of this lockdown, do we know how we can get to the people? Government has put out some palliative, but essentially, we're not getting to the people. We are relying on political bigwigs in the local government areas to tell us who is for. So basically, this crisis has exposed the degree of lack of governance. You can't govern without data, and it shows that right from local government to state to federal government, we have no data about who is where, who is poor, who doesn't have a job, who is informal sector. So the lack of this data, therefore, means that government capacity to manage the lockdown in the sense of helping the vulnerable is weakened, and therefore the lockdown might not achieve its purpose. So primarily, we are stepping up nicely to the Lagos State government in terms of public leadership, communication, but we are having problem with the desktop work, which means the real grind out, which is where are the people we want to help, who are those people, and take palliative to them in a sense that we can be sure that they have the patience to stay back while the tracing, while the monitoring and the testing happens. Without that, we might get into a serious crisis because people are protesting. And we can see people in the streets at the wrong time, and that will compound, that will even aggravate the communal transmission. That's really where we want to avoid.
Now, let's look at communal transmission now, which is what the Lagos State government is trying to avoid. It has adopted this house-to-house search for coronavirus cases. What are your thoughts on this move? Do you think perhaps we might see more rise in cases? What are your thoughts?
Yeah, of course, we're going to see a rise in cases. If you look at the per capita, look at the cities of African countries, like South Africa has done about 72,000 or 35,000 tests, and they are now in 1,000 and something, confirmed cases, with a population of about 50 million people. Nigeria, with a population of about 190 million to 200 million people, have just done about maybe 6,000 or thereabouts, 7,000 thereabouts. So primarily, our numbers are not representative of the rate of infection. So as we do more tests, don't forget that this is an asymptomatic disease, meaning that many people who are fine and going about their business or locked home at home might be carriers of the virus. So it's primarily as we escalate tests, we're going to get the results going up. But the problem now is that if we're not able to ramp up tests quickly, and then people are moving together, interacting, then the speed of infection is greater. And that's the wisdom of social distancing and lockdown, is that we can stop the spread while we take our time to deal with the testing, the isolation, and the management. We've been lucky and, of course, doing very well in terms of the rate of persons who have been discharged, who have tested negative after positive. That means the curative part is going on well. And we're also ramping up testing. But the critical problem we're going to have now is, are we able to keep our people locked down for at least the next 2 weeks to allow for more testing, isolation, treatment, and discharge? That's not going to happen except we're able to translate these palliatives on paper to palliate to people at home. So
all right, and that's a fine place to leave it right now. Sam Amadi, former chairman, Nigerian Electricity Regulatory Commission, we appreciate your insights on the news at 10.